my appreciation for all of you that have come out to this. By the afternoon, it's like, oh man, yeah. So especially after lunch, yeah. So, what? Oh, some people are saying, what lunch? Like, oh, man, you're hungry. Oh, hope you can concentrate. All right, my name is David Nakamaejo, and my company is called Comforting Hands Senior Care, and you got our newsletter, but our table is right out here. And I'm gonna do on fall prevention, and what you as a family caregiver can do, or you as an older adult, what you can do for yourself to prevent or lower the risk of falling. Okay, very, very important. I don't have to get into the morbid details about the negative things about falling, yeah? So our company, what we do is we have, and this is our 15-second commercial, what we do is that we have caregivers that will go to the senior's home to help the adult children take care of their parents, or parent, either one, yeah? And it's light housekeeping, medication reminder, bathing and dressing assistance, that kind of thing. So it can be once a week, twice a week, whatever, but up to the family, and it's to help take care of the elder, because it is a challenge. And you know, right now, for example, my brother and I are taking care of my mother, and she's 24 hours, 7 days a week. So right now, one of my workers are there, and my brother's going to go tonight. I was there last night, and my brother's on Saturday night, and I'm back Sunday night. And you know, Japanese mothers, I'm telling you, they're a whole different breed, man. We'll get into that. I know one person raised up their hand, but you haven't met a Jewish mother. Oh, wait. That's true, I haven't, so I can imagine if the Jewish mother is anything like my Japanese mother, yikes. Okay, so our services allow older adults to continue living in the comfort and privacy of their own home. I, as a owner of a company, I have not come across any elder yet, and I know one day I will. I have not come across an older adult that's turned to their son or daughter and said, hurry up, put my okole in a nursing home. No, most of them say, I don't want to go. I want to stay at home as long as I can. Yeah. And my mother is still living in the house we grew up in as kids. My grandfather passed away there, my grandmother passed away there, my father passed away there, and my mother says, I don't want to go in nursing home. And we told her, no, we're not putting you, you're going to stay here. It's almost 70 years already. And yeah. Driving us crazy, but so there are just two quick objectives. So take your time, no rush. There are two objectives or two things I want to accomplish in this short seminar, that workshop. First one is what you can do to prevent the falls. There are 4 basic areas that you as a caregiver need to make sure the senior does, or if you're the older adult here sitting here, the 4 areas you need to look at or look into, or things you need to do, okay? Real simple. And I'll get into each one in detail, and we'll talk about that. And then the second objective is, in case you fall, you're not hurt, I'll show you how to get up. Okay? I'll go lie on the floor for you. And I will. I'll get on the floor and I'll show you how to get up, assuming you're not hurt. If you're hurt, don't even try to get up. Okay, so real simple. All right, I said 4th. Yeah?
Could I just ask, is there like maybe a right way to fall? Like if you know you're kind of falling, to fall a certain way, or?
Question, is there a right way to fall? Nope.
To prevent, more injuries.
Oh,
Yeah.
well, I still practice Aikido, teach Aikido. You can tumble, but when you're eating something.
Yeah, that's hard to tumble.
Yeah, I don't think you can do that. Yeah. So there isn't, it's, so the key is, okay, so the question was, is there a right way, a way you can, lessen the injury if you're falling? Not really, because a fall comes so quickly It just catches you totally off guard.
Okay.
Okay, so, okay. I said 4 things that what you can do wrong for yourself or for the elder. 4 things. First one, get your medication reviewed. What do you mean by that? And we call it the brown bag test. What do you mean by brown bag test? Get a paper bag, literally, and put all the different medication you're taking, okay? Take all the over-the-counter supplements you're taking, any kind of ointments you're putting on that's over-the-counter, you put them in a brown bag. You don't have to. Just kind of bag it, or whatever, and take it to the pharmacist. So what do you mean by that? Why take it? Or your primary care physician. Why do I need to do this in a brown bag and take all the medication? Research has shown if you take 4 different medication prescription, your chances of falling rises because there may be they call it drug interaction, all right? And the drug interaction may make you dizzy, make you drowsy, or just may affect your balance. So if you and I know there are some elders that are taking 5, 6, 7, 8, 9 different medication because, right? They see the cardiologist, they see the arthritis doctor, rheumatologist, and they may see the pulmonary, the lung doctor. So all these different doctors you're seeing and all those different medications they're administering to or prescribing for you or the elder. So you need to, that's why when you go to the doctor, the nurse always asks you, any new medication? You go, no. Well, what are you taking? They're trained to ask you, even though you think to yourself, you get them on your records. I just told you never change. Why are you going to ask me what I'm taking? Nope, just in case. Because if the physician, he or she decides to prescribe another medication, they need to know all the ones you're taking so that they don't prescribe something that's going to conflict with it. That's why they always ask you, what you taking? Like, you ask me every time I come. But that's what happens. That's what they want to do. They don't want that conflict. All right. Now, if you don't want to go to your pharmacist and you don't want to bring it to your physician, then we highly recommend that you go to just one pharmacy. Do not go Costco. Then since you've just finished seeing a doctor at Queens, I feel lousy, so I just go to the pharmacy at Queens, more easy, and then of course I get some night longs. Yay. Then 3 different pharmacists have 3 different databases. You are 3 different medications. They don't know. But you go to one, they know all the medication you're taking. So that when you get a new prescription and you go to your longs or times or whatever you do, just at one pharmacy, bam, it'll come up on a screen. And if there's any potential conflict, that pharmacist is responsible for calling your doctor and saying, Dr. So-and-so, you prescribed this. This may interact negatively with, do you know about that? Okay? One pharmacy. I don't care which one. Just one, whatever it may be. Okay? So like I said, that's the first thing, because you can get dizzy, drowsiness, balance problems. That's what multiple medications can cause. Next one. Your eyes. Get it checked annually. Okay? You need to get it checked annually, because for obvious reasons, you need your glasses, or not glasses, you need good eyesight when you're walking, because you have to see where you're walking. So get it checked. When I look into the audience, I look at people's glasses and I can tell, because some of the glasses the older adult is wearing looks new. So I can tell they went to the doctor. Get others of you sitting here and your glasses look like from World War II. You haven't been to the eye doctor in years. And then I get some elders out here looking at it and they're going like this. At this screen like, yeah. Oh, man. Okay. And all of us have heard about cataracts and glaucoma. So there's all types of eye issues that will crop up as we get older, and then affects your vision and therefore increases your chances of falling. So get your eyes checked every year. Okay? I get some elders sitting out there, and I know they don't put on contacts. And you gotta tell me you got 20/20 vision. I don't know. Yeah? So get your eyes checked. Really, really important. At least annually. In line with your eyes, since we'll talk about that. Okay? So first thing is get your medicine reviewed now, at least annually. And you know what? Every pharmacist is more than willing to do it. You ask the pharmacist, can I bring my medications that I'm taking that I just want to review? They're going to tell you, no pharmacist is going to tell you no, because that's their responsibility. They're more than happy. Make an appointment, obviously. You just can't just drop in. But you know, you make an appointment and just take your parents' medication and they'll do it. Okay? That's the first thing. Second thing is get your eyes checked, yeah? But closely related to our eyes is hearing. Okay. Now you're saying that what does your ears got to do with walking and increasing your chance of falling? Our inner ear, semicircular canal, helps us with balance. Okay. So if the older adult is telling you, my right side, my ear ringing, that's not good, tinnitus, but it may or may not be serious. However, it may be something going on inside your ear and may affect your balance. So you got to get it checked. Now, we're not talking about losing. As we age, we just get harder to hear. We're not talking about that. That's a separate issue, because I get so many women come up to me and say, God found that husband, he's deaf already. He just no listen. But they don't know our men. We call it selective listening. We don't listen to our wives. Only what we like hear, then we pay attention. And our wives know that already, so we cannot fool them. So ringing in the ear, go and see the doctor. That is why when children, those of you that remember raising your kids, when the kid has, for example, a pretty nasty sore throat and it kind of migrates to the ear, and you get the ear infection, and then the pediatrician right away can figure, kid's got a throat infection because it affects the inner ear, and the kid walks to the doctor like this. And he said, well, walk straight. No, I am, because their sense of balance is thrown off. So they think they're walking straight, but they're not. They're slanted. The pediatrician picks it up right away. Come, let me check your ears. You take his temperature, and let's look into this. Yeah, that's your ear. Okay, next one. And then loss of feeling in your feet. When you go to the doctor, I'm too young yet. My father used to go to the doctor. What the doctor used to do, my father just passed, not just, 6 years ago, wow. You know, he would get, that hammer, the rubber hammer, and then that silver thing. He would turn it around, and he'd go like this on the bottom of your feet. Okay? So he'll do that with my father, and interesting, because I know what he's doing. The doctor is checking if my father is losing any kind of feeling in his feet, peripheral neuropathy, fancy word. But you're losing that sensation, because you need that feeling of the ground, when you're walking. So he goes like this, he goes like this, then my father's toes go, okay, got feelings. So that's what they're doing. So if the elder tells you, get needles in my feet, or it's not, I don't feel too much, get it checked, because again, the risk of falling increases. In fact, just last week, I told my younger brother, pay attention to mom. I help her get up from the dining table. And then she uses to walk around the house, and then she starts walking. So I told my way. She goes, why? The house slippers. She got one side on, left side foot still by the, just right behind the chair. I said, Mama, your slippers. She go, oh yeah. Gee, I never even feel that. I says, don't worry, Ma, it's okay. I call up my brother. I says, hey, Mom didn't know that she couldn't feel it. So we go to, I follow her to the living room. She sits on the couch, and I says, can I see your feet? And typical mother, why? I just want to look, Ma. I said, it's okay. I know it's okay, but just because I'm worried that you're losing feeling. Oh, she goes, oh, okay. So, I pick up her feet, and I just kind of she goes, hey, tickle. Okay, she's good. Yeah, yeah, yeah. Okay. She goes, oh, how you? She goes like, give me you funny looking. I just testing it, so. She shake her head, but you know Japanese mothers there. Another one is, you know when.
Needles.
What's that?
Feel like, or needles.
You know when you sit down for a certain way, long time, you get the needles. They call it peripheral neuropathy, and that's part of it. And then you find out, even us, I mean at our age, young age, but there's a tendency you get that, and that's just an indication that something's amiss or something's wrong, and the physician's got to figure out what it is. We're not doctors, but that's an indication, that they're gonna lose their sensation in their feeling. I mean their feet, the feeling. So you got to get that checked. Very, very important. Yeah.
And that's related to falling too.
Well, because you're numb, right? And you don't feel it. So when you're walking, it's not that good. Yeah. It raises the risk of falling. Doesn't mean that you're going to fall. Yeah.
What kind of doctor would check?
Your primary care physician would look into it first, and then if he or she is unable to determine what it is, then they'll probably send them to a specialist, like a neurologist or something. Yeah. But you do want to get it checked because you don't want the elder to fall. Yeah. Yeah. So have that checked. And then, when you're young and you get up in the morning, you can just turn off the alarm and you just can get out of bed and go, okay, I go to the bathroom, I'm ready to go get ready for work or anything. But you know what? Like for me personally, when you first get up in the morning, I don't get out of bed right away, I sit up and I go, I got to make sure everything working, man. Yeah, I ain't jumping out of bed, man. And that's okay. Yeah, I'm going to get up slowly, man. And you get up slowly. Yeah. What's going to happen is you may hear the older adult saying, I get numbness in my leg. That's a sheer sign to get it checked already. Don't even wait. You know what the doctor is not going to want to hear? Oh, Koye is my father. But it didn't happen to him. But, gee, what happened after I went fall? He says, oh, okay, what happened? My left side, get numb sometime. I don't have feeling. Oh, yeah? Well, how long has it been going on? About 5 months. Yeah, right. That's too long. So as soon as that starts happening, your feet, your legs, get it checked. Ringing in the ear, check your eyes, check your medicine. Yeah, enough. It's like next. The third thing, right? I said there are 4 basic things. 1, check your medication. 2, check your eyes. And the third one is exercise. And the reason I gave you our spring newsletter is if you open up inside, Michael. Oh, you need, okay. Who else needs? What you got? Okay, you got one. Everybody got one? Sure. Okay, if you look inside, you're gonna see, and then I was just talking to that gentleman back there. That interesting, yeah. This about Parkinson's, and research has been done. I'm not saying that it doesn't cure Parkinson's, but anyway, Tai Chi, and then I think I was talking to you, yeah, yeah. So Elena, the picture of this lady came this morning at my morning session, and she went through. She is the master trainer for Tai Chi for Health. And the only reason why is that, I'm a certified instructor too. She's my sensei. So I asked her if she was available. She said, oh, come. And then I said, but I'm going to take you through today's afternoon session. I mean, just we'll spend about 15 minutes and we'll go through what's known as seated Tai Chi sitting down. Because Dr. Lam's program has Tai Chi for the wheelchair bound or seated. They don't want to use the word. Wheelchair sounds negative. If you're they call it seated Tai Chi. So I'll stand, but you can remain seated. You want to stand up, you can, but we're not going to move around. Okay, we're going to stay seated or stay in position. So more than enough research, and they call it evidence-based research, has been conducted in terms of how Tai Chi helps prevent falls. Yeah, because what Tai Chi does is improves our balance, which is critical. Yeah, actually any kind of exercise, swim, hike, walk, whatever, tennis. But when you get to a certain stage, playing tennis is pretty rough. Okay. It improves balance. Yeah? Tai Chi strengthens the joints, strengthens your muscle, and keeps you flexible. Right? So I really, and Tai Chi is almost, well, I shouldn't say almost. I was telling Elena over lunch, because we had lunch together, and then I was telling her that, because I've been taking and teaching Aikido for years. So you know, Aikido also teaches you balance and, you know, this kind of stuff. And that's what I was telling you about tumbling. But I wouldn't want to tumble at my age either. Okay, so we're going to go through about quick Tai Chi. And then I'll move on to number 4. All right, so what I'm going to want you to do is sit at the edge of the chair. And, you know, put those things on the side, and we're going to just practice some Tai Chi. I mean, if you want to just watch, it's okay too. All right. Now, one of the things that Tai Chi emphasizes, there are no mistakes, there are no errors. Okay? Because it's a form of exercise, a form of calming us, right? Lowering our blood pressure, lowering our heart rate. Yeah. It's like meditation. So the first thing we're going to do is learn how to breathe. And in Tai Chi, breathing is very important. And those of you that have studied about Qi, like in Aikido, or Qi in Chinese, it's building your inner strength. So what I want you to do is just relax and just, you know, sit at the edge of the chair, and then bring your hands up slowly, breathe in. And then come down. Okay, exhale. It's nice and calm. Okay, breathe in. Expand your belly. Stay calm. Exhale. We call this centering breath, centering breathing. Okay? And when we say center in Tai Chi, and like in Aikido, your center is about 2 to 3 fingers below your belly button. That is the center of gravity in your body, and about 3 fingers inside. So that's your hara, your center, or your dantian in Tai Chi. And what you're doing is that you're putting energy, and this is Star Wars Yoda stuff. You're putting energy into your dantian, or your hara, your center. Okay, so that was what it is. Now, what we're going to do is I'm going to keep you seated, and we're going to go through and just follow me, and just imagine a nice either ocean, you're at a park, you're on the mountain, and just nice and calm. And we're going to do some Tai Chi warm-ups first. Then I'm going to take you through some basic arthritis fall prevention movements. Okay, so the first we're going to work on our neck. So slowly come up. Everything is slow, nice, slow, slow, slow. Okay, turn your palms. Okay, bend your elbow and push as if you're pushing your chin. Move your chin back. Okay, turn. Push it out, slow, slow, and follow your hand down. Okay, just stretch, gently stretch your neck. That's once. One more time. Up, slow. Breathe in slowly, because we're teaching the body to move slowly. Turn. Push as if you push it. Push your chin back. Okay, turn. Push your hand out. And follow your hand down. 2. One more time. Nice and slow. Breathe. Feel yourself calming down. Coming up. Okay, turn. Push it in, turn, push it out. Okay, calm. Good, good. Okay. Bring your hand slowly up. Your right hand down and your left hand, okay? Either way, it doesn't really matter. Okay, what I need you to do is visualize see this middle finger, and only your head turns, your neck. It's just turning. Okay, slowly, just slowly. That's it. Don't strain. Come back. Follow your middle finger. Turn. We are warming up the neck. So just turn about 60%. That's enough. Don't. This is not a contest. Come back. Okay, that's once. Okay, little bit more. Okay. Move slow. Feel yourself calming down. That's what Tai Chi is supposed to do. Okay. In Aikido, we're telling them, send your ki out. Send it all forward. Just follow it. Good. Go slow, slow, slow. It's hard for us to move slow. That away. Good, you guys. Okay. Okay, that was the neck. Now we're going to work shoulders. Just come back, slow. Okay, put your hands down. Okay, we're going to roll our shoulders forward 3 times. Slowly, 1, slow, 1. Okay, we're warming up our shoulders. 2, 3. Okay, now we're going to roll backwards. 1, just nice and slow. Good. Keep your hands to the side. Breathe now, people. Don't hold your breath. Okay. Okay, that was 3 times. Okay, good. Now we're going to do our rotary cuff, but still on our shoulder. Okay. Come up. Breathe in so you can feel your shoulders go. And then imagine pushing energy into your center of your body. Okay, that's 1. One more time. 2. See, we're moving the shoulder. Good. 2. Nice and calm, everybody. One more. Okay, exhale. Okay, good. Okay. Now we're going to go through some basic movements, but still seated. Okay. So you just follow me as best you can, and this is called Tai Chi for fall prevention, and we're just teaching you the movement so you can just breathe and exercise. Okay. So I'm going to just do it once, and I need you to follow afterwards. Just watch me. If you want to follow, it's okay, but the first time, let me do it. Okay, so it's called Tai Chi for arthritis. Commence. And what happens is, okay, do that. We'll do it twice, and then I'll add another movement. Then we can stop after, that way, right? Okay, ready? Just stay calm. Breathe. Center yourself. Don't get too excited. Just stay calm. Okay. When I say commence, that's when we're going to start. Okay. Okay. Tai Chi for fall prevention. Commence. Slowly come up. Good. Okay. Point your fingers to the heaven. Come straight down. Put it towards you. Come up. Put your hand forward. Ooh, good, you guys. Slow. Come back. This is called open. Close. And come back down. Very good. Ooh. You guys should come to my class. You guys catch on fast. Okay. I'm just going to add one more movement, and that's just the 3 basic movements that there's 6 altogether, but we won't get into that. I might just do the whole thing for you right now, and then you guys can just watch, but I don't have Tai Chi shoes, I got dress shoes, so that might be a challenge. Okay, what I'm going to do is let me just demonstrate it once, and then we'll do it together. Okay. Okay, Tai Chi for arthritis. Okay, commence. Okay, just watch. Okay, fingers to the heaven. Come down. Continuous movement. Control your breathing. Okay, open, close. This is called single whip. And you okay. Okay, ready? Let's do it together. Breathe slowly. Okay. Okay, you ready? Commence. Slowly breathe in. Come up. See the sky. Good. Come towards you. Up along your chest. Forward. Good. Bring it back to you. Open. Close. Turn to your right. Push your hands forward and open the curtain. That's what they call it. Okay. Good. Good. Okay. It's supposed to calm you. Yeah. Feel more relaxed. Okay. I have not come across a Tai Chi student that when we went through a practice, they come out like, oh man, I'm all excited. It's like usually, oh yeah, this is mellowing me out. And yeah, that's what it's supposed to. That's how it lowers your blood pressure, keeps the joint, yeah, and it's good. Okay, so very good. Anyway, okay, enough on that. But if you can, Tai Chi is good. All right, so let's go into the fourth one. And this, I said, remember, 4, get your medication reviewed, have your eyesight checked, exercise. We went just into Tai Chi. But if you're into walking, jogging, whatever kind of, just move. Yeah, exercise. And this last one, there are simple things around the house. It's known as home modifications. So the 4th thing you can do to lower the risk of falling is some simple home modification, or things you can do around the house. Doesn't mean you gotta fix something or construction. Excuse me. It can be anything. That's simple. All right. First one. How many of you wear this kind of slippers? Okay. Because you know why? It's dangerous, not good. Because can you imagine an elder wearing this kind of slipper, yeah? And it's in the morning, and you're early, like 2 o'clock, and you gotta go shishi, and guess how they walk to the bathroom? You're gonna trip. House slippers are not good. Okay? Summertime, it's not too bad. But during winter, when it's cold, I see elders wearing this kind of slippers, and then they put on this kind of socks. It makes it even worse. All right? Don't do that. So really discourage the elder from wearing athletic socks. And this, well, they don't wear this kind of slippers, actually. They wear these ones. And these are slippery. So that's what's dangerous, yeah. Okay. So remember, wow. I had one elder raise up there. He said, hey, I got those. I said, oh, good. How do you get them? He said, oh, I was at Queens. I said, well, I don't recommend getting admitted to the hospital just so you can get a pair of socks like this. Go to the medical supply companies and they have this, okay? Because it has a grip. That's what the hospitals give. They don't want that kind of socks. The nurses see it. They have a cow. They go, no, take it away. You got to wear these, okay? And this already said all the medical supply pays. Yeah. So, like $3.95, $2.95, $2.95. It's called traction slippers. All right. For this group, I was watching the elders come in, and this group is good. I didn't see any elder where I thought, how come you're not using a cane or a walker? So this group is one of the few groups that I'm speaking to that don't have. But usually when I talk to a group, there's 1 or 2 elders, like, how come they're not using a cane or a walker? Yeah, they refuse. But you know what? You just raised your risk of falling. Okay? I know, that means just being hot-headed. Yeah, being hot-headed. So if you need assisted device, use it. Okay? being in denial does not help you. Yeah? So if you need it, start using it. That's all. That's another thing you can do around the house. Everybody knows about this. Get grab bars. Install grab bars. Really, really important in the bathroom. Grab bars. I do not want to hear, as so many times we hear from elders, I don't need grab bar. I use the towel rack. Jeez. Another one is, I don't need, I use a soap dish. I mean, it can work to a certain degree, but that's not what it's intended to. It ain't intended to help you in and out of the bathroom. It's intended to hold the soap, not your body weight. Yeah. Okay, so get the grab bars. And the bathroom, as all of us would suspect, and the answer is yes, that's the most common place they fall. Yeah. Yeah.
I noticed that bars horizontal.
Yeah. Vertical.
Vertical?
Yeah.
Don't they recommend horizontal bars? Because the vertical you can slip.
Yeah, okay, she said notice, but you know what this photo doesn't have? It depends on where it is. It could be inside, because you could have one on the outside, you know what I mean? And a lot of times they have it at an angle too. When you're going to sit in a chair, yeah, so depending, and you can have more than just one. You can have one like this and one like this. Yeah? Yeah. She's saying, she noticed that it's up and down. Yeah. You can slip. You can slip on either one of them, but just grab at the bottom of it. Just grab from here, yeah. If you're gonna, you can grab there, but yeah, it should be. So when you use a contractor, they will usually know where to put it, and they'll ask how you get in. They should ask, and then you just get it, yeah. And no. So grab bars is, but most people know about grab bars already. And people know about this because they see a lot of it now. The shower chairs. I put the shower chairs in, and inside. You can sit down, get the handheld, yeah. Just that much easier. So the grab bars with the shower chair and the handheld, good, you're safe. Yeah. There's even contractors that will cut part of your tub away so you can kind of like just walk in. Yeah. So anyway, modification. Everybody knows about night lights, so I'm not going to get into that. Use night lights. Nowadays, they're coming out a lot now, especially now. Okay, you see this. I'll pass it around. This is the type of flashlight you plug into your socket, and it serves as a night light and a recharged or charged flashlight. So if power goes out, just grab the thing and yank them out, and you got a flashlight. And here's another one. So it's a night light. So yeah. What's hard for elders, if you put them in a bedroom and electricity go out, you got to bend over, which is kind of rough to get it from. So we tell elders, put them in the bathroom and just get regular night lights in your bedroom. Okay? So. This one, throw rugs. Okay, this is an absolute no-no. Any kind of, these rugs, the one they sell this at Long's for $4.99. Tell you, it's a trip hazard. Just get it away. Besides these kind of small throw rugs that can be a trip hazard, you know what local people do? Because they don't want to waste. When you put in new carpet, the carpet layers leave the extra carpet. And they said, well, owner, you paid for it, so we're not taking it back. It's yours. So you know what we do? We cut out the size of this mat, and we get another piece of carpet, and we put them by our bathroom sink. We cut another piece, and we put them by the kitchen sink. And we cut another piece, and we put them right when you slide the door open to go out into the lanai. That's the worst thing to do. That piece of carpet is going to trip you. All right? I know so many of the elders tell me, hey, boy, son, just wasteful you throw them away. Heck of a lot better than fall on your face. Yeah? I mean, yeah. So I tell the adult children, when your parents go Vegas, throw them out. Yeah. Senior citizens are pack rats. They keep everything. That's why, too bad, the declutter seminar is the same time as this one, just an opposite room. And so many adult children, they're going, oh, they just roll their eyes. So I know already that their parents are, they keep everything. My parents had the best recycling system you can ever think of. My father would get rubbish together and tell me, take them out. So I take them out to the curb. My mother brings it in. And she tell me, shh, not tell daddy, it's still good. Okay? Then my mother, the next week or the following couple weeks later, gets some stuff, throw them out. And then my father brings it back in. Anytime you should not tell mom, it's still good. Like, holy poopers, you guys. But, I mean, that's you know, when you grew up during that Depression time and when you're poor and you struggle, that's expected. You know, not fun being poor, and they went through it. They sacrificed for us. But, oh, no. Declutter, get rid of it. Oh, you guys keep everything. And I'm telling you, you guys ready for a tsunami and everything else and nuclear war and everything? Nah, just in case. Yeah, right. But keep the pathways clear. So that's important to declutter. So see Cynthia. I don't know, but declutter why they're good at helping your parents get rid of the stuff. Okay. I don't have a low chair. Okay, it's okay. We'll skip this one because I'm running out of time. Almost power. Okay, we recommend you keep a blanket, bottle of water, and what you do is you put the blanket, well, you fold them nicely. And you keep this at the bottom cupboard, the last shelf in your bathroom. You keep one in your bedroom on the side, but a chest of drawer, and one in the living room. And you're thinking, why? He said, in case you fall, you hurt, you cannot get up, you gotta keep warm because you're going to shock, and you can get dehydrated. Okay? Because you and I have heard horror stories. 1 hour on the floor, 2 hours, 5, 10 hours, or even a whole day on the bathroom floor or the floor. If you don't get liquids in you and you don't keep warm, your survival rate drops. So that's why you should keep that. Okay? Keep it around the house. I hope you never use it. That means you never fall. Okay? But just in case. Okay? Okay. What are the places again? Bathroom, which is common, so put them on the bottom so that you can get it, and then living room, and then the bathroom. Yeah, bedroom. Thank you. Okay. So keep that. All right, that was the first. So we're going to the second objective, which was getting up from a fall. So. Oops. Ooh. Okay. I'm going to show you or demonstrate how to get up from a fall. Right. Now, this is assuming you're not hurt. So if you fall or the elder falls and they got pain, don't even try to get up. But a lot of times elders, they kind of just slide off the chair, or they get up and they just kind of slide off and they're on the floor, and they're not hurt. So you teach them how to get up, all right? So I'm just going to flash through the slides, but I'll demonstrate it. Okay. So what you need to do is roll on your stomach, get on your hands and knees, crawl to a chair, okay, bed, but without wheels, all right? Approach it, both hands on it, put your leg, and then get up, and then turn around, okay? So what you do is, it's the last part already. Okay, so if you're on the floor and then you say, okay, I'm not hurt, I'm okay. So what you need to do is turn onto your stomach. Okay? Then get on your hands and knees, and then crawl to something sturdy. Put both hands, right, on it. One foot. Push up. And turn around and sit. Okay? Now, if you got arthritis in your knees, too much pain, you got to call 911. And you can call the fire department and tell them, not hurt, I just need help in getting them up. And they'll come without the sirens going. They'll come, but kind of obvious. The fire truck, not the quietest automobile. Yeah, they get out like all the neighbors know already. Okay, what happened? We're going to come quietly. Yeah, right. Okay, one more time. So, now if you're on the floor, you know what? It's only natural for us, and which can lead to injury. People try and get up this way. And you just come up, and then you're gonna fall back and hit your head. And then sometimes they'll just turn to the side and they're gonna try and get up. If you're on the bed, you can do that, because when you're on the bed, that's what they recommend how you do it. But if you're on the floor, turn on your stomach. Get on your hands and knees. And if you're in pain, go back down. Forget it. Call 911. Okay, but crawl to the chair. Get on top. Put your hand. Get up. And then sit. And stay there for a little while. And then easier said than done. Yeah. So, quick review. Medication, have your eyes checked, exercise, and do simple modification around the house. Yeah? Please don't fall. Yeah, falling is not fun. And you guys know the stories about people falling in. And that's it. Power ready. All downhill. Okay? 3 o'clock. That was the alarm. Thank you. Bye-bye.